Hey there, my name is Dr. Kimberly L. I'm a board-certified OB/GYN doctor with nearly 20 years of experience, and I want to talk to you today about one of my favorite topics, and that has to do with feminine rejuvenation. We're going to specifically be talking about things such as the OSHOT, Cosmetic Gynecology, as well as other things that we do provide. Here's my medical advice disclaimer. Please know that all patients are different, so you do have to talk to your own doctor about the right treatment that's right for you. But again, this is one of my favorite things to talk about. I am here in Sugar Land, Texas, which is right outside of Houston. We are lucky and thankful enough to have such a diverse patient population, and to talk to women from basically all over the world about their different things. We all have very common things in mind, such as, when we get older, our bodies will go through changes and things like that. So for me, it really became my mission and my goal to figure out, what was the best things to help women in this area to help rejuvenate that area. So I just want to talk to you about what some of the goals are. My goal is to be able to help correct you for what you feel or that you're not feeling. It's important to know, as I say in a lot of things, that every patient is different. There are many reasons for women wanting to change something. Some women, they may like how it looks, but it may not function well. Some women, they like the function, but it may not look very good. So again, there's many different things to actually consider. There's also things that we go through in life that are very important. So things such as childbirth, other medical conditions, menopausal status, those are all things that are very, very important to deciding what the best treatment for you is, as well as, and I actually didn't even put up here, but there's your partner effect too. So, certainly the goal of every therapy is to just make things much more comfortable, much more enjoyable for both of you. So I just wanted to kind of put that disclaimer out there too. So guys, you are very important too to this equation. So my goal as board certified OB/GYN doctor, as well as cosmetic gynecologist, as well as, really kind of carving out a niche in terms of helping people with sexual dysfunction in general, is to help people with not only the form, but as well as the function, because it's my thought always that, if something looks good, it's great, but, does it function well? Who wants to look like Barbie and then, you are incontinent? That's just not fun at all. So, so when we talks about the complexities of actually being a woman, and this is actually a really cool picture that I wanted to put up for you. So this is basically female anatomy. So we have a lot of different parts here. We have the rectum here, we have the vagina here, uterus is here, if you still have one, as well as the fallopian tubes and ovaries are here, as well as the bladder that's here. The G-spot is here, as well as the clitoris is actually here. It's important for you to know that as we age, we're going to have things such as hormonal changes. As our hormones go down, we can actually experience things like, moisture issues, as well as problems with libido issues. Childbirth, that can actually cause trauma to the area, and it really makes it harder to actually feel your partner. You can have weight changes that can lead to things like incontinence, or again, just not being able to feel the right things, and other medical conditions like diabetics. They usually have trouble with things like sensation. They may actually have problems with incontinence, as well as frequent yeast infections. Those are just some things that I actually saw during my years of practice. So problems with painful intercourse, and this is where we get into hormones. So if I had a patient, she came and said, hey, I'm having pain with intercourse, this is where I would look, okay? There's certainly other things to look at too. For example, you do want to make sure that she otherwise has normal anatomy. You want to make sure that she doesn't have, like a big mass in her tummy that's actually leading to the pain. So it's important to know that as far as hormones go, as we age, again, we're going to have lower estrogen levels. These are things that lead to things like burning, irritation, discomfort, and you just can't moisturize enough. So you're using, your lubrication, you're using your oils, all your KY jellies, and still they're not enough. The other thing that causes is less elasticity, as well as lower blood flow. I mentioned the dryness, as well as pain for intercourse. I have some ladies where they get so dry, even with the outer intercourse, they'll wipe themselves and they'll actually see a little spot of blood because the area tears in that area. So this is where adding hormones can help. So things like vaginal estrogen, as well as Bio-T hormone balancing, are things that really help women, as well as if you feel better in general in this area, guess what? That's going to actually help your desire and your desire to actually use it. So I have some ladies that have problems with sensation. And what I have for that is actually called the O shot. So if this is the clitoris and then just the G-spot area, what we do is we actually take your blood and we spin it down to what's called platelet-rich plasma. This is then injected into these areas. Okay, and then what happens is it helps rejuvenate the tissue that's there. The platelets contain proteins that actually helps increase the blood flow. It helps increase those nerve endings so that, guess what, we end up with more moisture. We actually also end up with, fixing ladies' incontinence issues, things like that, but also the sensation, like being able to have orgasms. A lot of my patients actually say they go from having just one orgasm down to multiple orgasms. So those are the benefits of the O shot. The other things that we have is called the Ultrafilm 360. This is for ladies that may have problems with the laxity, but they may not have enough laxity that would require actual surgical intervention yet. This is something that uses radio frequency energy, and what happens is that it treats the inside of the vagina as well as the outside of the vagina. What people feel commonly is a warming sensation, almost like a hot stone massage. This is something that helps with laxity as well as incontinence, as well as moisture. These are all the things that basically my patients say helps them, as well as, of course, if you help fix all these things, then guess what? They're going to have a better sex life too. So this is something, if you look at this is the before picture, how the vagina could be, and then afterwards it helps increase that collagen. And this is actually, you can probably barely see this, but this is actually staining of the tissue. And if the pink is the blue that's here, what happens is that you have a 41% increase in those elastin fibers. That helps. So this is something that's really awesome, for patients. Another thing that we have to help is for ladies with problems with incontinence. Not only will the O shot help with that, the Ultrafilm 360 also helps with that. And you can see where we're going because all of these things they kind of work synergistically on top of each other. We also have the Insula. This is something that you can remain fully dressed and you sit in a chair, and it uses electromagnetic waves to actually treat the pelvic floor muscles. This can actually give you up to 11,000 Kegels within a single 28-minute session. So it's really cool. It's painless. Again, it's very easy to do. You just sit there on a chair. It basically does all the work for you. And again, it helps with things like laxity, incontinence, stronger orgasm. I actually did a study on this which showed that there was an increase in sexual function to be able to help women. So again, one of the things that I coined is if you combine the O shot with the Insula, that's actually called the Ultra O. If you combine the O shot with the BTL Ultrafilm 360, that's actually called my Ultimate O, because again, they act synergistically on each other in order to help increase the issues that us ladies can feel. So for some ladies where, they are not candidates for non-surgical treatment, they actually do need some sort of surgical intervention. I've seen this before too, where, for example, they've had birth trauma and, they have scar tissue that's there that can be painful, or really it's just like, there's a lot of laxity that's there. Some ladies actually have air that get caught in the area. You can actually have problems with both partners, where the partner may say, the husband may say like, hey, I can't feel my wife, or the wife can actually say, hey, I can't feel my husband. Then yes, those are things that also can be improved by this. So we have things that can actually help tighten the vagina opening, and that's called the perineoplasty or vaginoplasty. Or if it's something where the labia is very large and very bothersome, that's something that's called a labiaplasty. So all of these things are based on, what women want, what they desire, and again, because every woman is different, that's why we have to have a lot of things to actually customize your treatment. So again, my name is Dr. Kimberly Evans. Again, here's my brief little talk about feminine rejuvenation regarding the O shot, cosmetic gynecology, the Insula, the Ultrafilm 360. Again, we have a lot of things to help our ladies. So just wanted to let you know, hey, we're here for you. If you wanted to book a consultation, you can actually do that on our website, www.sugarlandmedspa.com. Take care.